Wait. Great. Thank you very much for having me. My name is Alex. I am a research fellow at Origin and the University of Melbourne. And today I'm going to present some findings from a recent systematic review and meta-analysis we conducted. I don't think methamphetamine needs an introduction in this room, but very briefly, it is a widely used psychostimulant worldwide. And importantly, its use is associated with a range of adverse outcomes. The important part of my talk is the fact that it typically starts in adolescence or young adulthood, with the median age of onset in the United States and in Australia being around 20 years old. This is concerning, as early age of onset of substance use usually increases the risk of developing a substance use disorder later in life, and also increases the risk of relapse after abstinence. So despite this early age of onset in adolescence, most of the research in methamphetamine use has been conducted in adults to date. And importantly, most of the treatments have been tested in adults. So it's very important to understand outcomes associated with use in youth to develop new targeted treatment and new early intervention targeting methamphetamine use in youth. So the aim of this review was to first systematically assess the evidence on health, functional, and cognitive outcomes in young people aged 10 to 25 years old who use methamphetamine. And the second aim was to quantitatively assess those associations using a meta-analytical approach. And we selected the age range 10 to 25 because this encompasses childhood and adolescence. We looked through a number of databases, and importantly, we kept our search terms very broad to make sure we didn't miss any papers out there. We first identified over 3,600 papers. Thankfully, nearly half of them were duplicates, so that made our lives much easier. So we screened about 1,800 papers for title and abstract, and we ended up with 267 papers screened for full text. And in the end, 60 of them were included in the systematic review. And you can see here on the slide why some of the reports were excluded. The main reasons were because they were done in adults, they didn't have a proper comparison group, or didn't have the outcomes we were interested in. In terms of the 66 study we identified, I'm going to show you some of the characteristics. 19 of them had people with a formal diagnosis of DSM-4 or DSM-5 methamphetamine dependence or abuse or methamphetamine use disorder, respectively. And 47 of them had young people who self-reported using methamphetamine. And that actually varied very widely, with some studies looking at self-reported lifetime use, so it could have been just one time in their entire life, and some other studies looking at self-reported daily use, for example. In terms of study settings, 21 studies were conducted in schools, 18 in the community, 9 in youth detention, 8 with homeless youth, 8 in substance use treatment, and a handful just in mental health treatment facilities. Now let's have a look at our outcomes of interest. We identified 44 studies looking at health outcomes. The most studied outcome was mood disorders and associated symptoms in nearly half of them, followed by anxiety disorders and associated symptoms. In terms of functional outcomes, we identified 43 studies. Most of them looked at education and employment, justice system involvement, and family functioning. Lastly, for our cognitive outcomes, we identified 6 studies, and most of them look at inhibitory control performance. Now, I want to spend a bit of time talking a bit about those significant outcomes we identified, and I'll start with the health ones. The main finding of this paper really is that adolescents who use methamphetamine were 13 times more likely to have conduct disorder. So you can see the result of the meta-analysis here. The overall effect was quite strong. And in addition, we also identified a number of antisocial behaviors associated with methamphetamine use in youth. Young people who use methamphetamine were more likely to exhibit antisocial behaviors. They had higher hostility symptoms, more likely to fight with peers, and had more difficulties with peer interactions, compared to both young people who did not use methamphetamine or other drugs and young people who use drugs other than methamphetamine. And those antisocial behaviors are consistent with conduct disorder diagnosis that we identified. In terms of functional outcome, before I get into them, I just want to say that we couldn't actually conduct a meta-analysis on these outcomes because the way they were reported were very heterogeneous. Some studies used very different scales, and some of them use self-reported statements, others use more structured scales, so it was hard to do meta-analysis. We did, however, found that methamphetamine use in youth was constantly associated with poor educational outcomes, and those including not attending school, being kicked out of school, low grades, not completing high school. We also found that methamphetamine use in youth was associated with involvement in the justice system. So that's including youth detention, being in trouble with the police, and so on. In terms of cognitive outcomes, what we found is that youth who use methamphetamine displayed poorer performance in an inhibitory control task, and that is consistent with what we see in adults as well. I want to spend a bit of time looking at limitations of the current literature and where we can go next. So key limitations we identified in the current literature is, as I previously mentioned, heterogeneous measurement of exposure and outcomes. So exposure measurement really varied widely between studies. As I said, it ranged all the way from self-reported lifetime use to current methamphetamine use disorder. In addition, measurement of outcomes was quite varied and not standardized across studies. There was also a lack of adequate control, and one I want to talk about specifically today is control for acute and residual methamphetamine use. So we know that acute methamphetamine use can have a direct effect on health outcomes. So for example, depression symptoms are usually heightened during withdrawal, and anxiety symptoms can be heightened during acute intoxication. So it's very important that future studies actually control for acute and residual use. For example, by testing after a week of abstinence. And there's also a direct effect of acute methamphetamine intoxication on cognitive performance, with methamphetamine use actually having cognitive enhancing properties. And there was also limited causal evidence. Out of the 66 studies were identified, only 5 of them had a longitudinal component. So we actually are unsure what the direction of the effect is. So for example, if we go back to the conduct disorder, it's unclear whether young people who have a conduct disorder are more likely to experiment with methamphetamine use early in life, or is it using methamphetamine early in life that leads to meet criteria for conduct disorder? So there's a bit of work left to be done here. So in conclusion, we found a strong association between conduct disorder and methamphetamine use in youth. Young people who use methamphetamine were more likely to be involved with, in the youth justice system. Educational problems were consistently associated with methamphetamine use in this population, and they also displayed poor performance on an inhibitory control task. Yes, in terms of future direction, as I just mentioned, there is a need to assess those outcomes longitudinally using more validated tools, and that's particularly true for the functional outcomes. And lastly, this work can help us develop treatment targeting the most commonly co-occurring health, functional, and cognitive symptoms that we see in young people who use methamphetamine. And the work was very recently published, so if you want to have a look at the full story, please check it out. And I would like to thank NCRED for supporting my work for the last few years, and also everyone involved with this work. And also would like to pay my respect to the elders of the land on which this work was conducted, the Wurundjeri people of the Kulin Nation. Thank you.
Time for one question.
Thanks. That's very interesting. Thanks for your presentation. My question is, how surprised were you that there was an overlap with conduct disorder and methamphetamine? I mean, there's kind of categorical similarities, and we know that people with substance use, adolescents with substance use disorder, often have diagnosed conduct disorder that resolves when you treat the substance use disorder.
Look, it wasn't all that surprising, but it was interesting that it was confirmed using meta-analytical approach. So it was the only consistent effect that we saw in the literature. So not all surprising, but interesting. Well, what we think we can do is target young people with conduct problems very early on to pretty much try to prevent both them developing a formal conduct disorder and also start initiating with drugs such as methamphetamine. So there's a lot of work to be done, and very excited about this.
Thank you.
Thank you.